the University of the Sciences at the University of the Western Cape, South Africa. My topic, spiritual care in complementary and good day. This is Dr. Mujib Hussain, coordinator of Unani.
دکتر زرگران
Within the Faculty of Community and Health Sciences
Yes,
at the
it is okay. Thank
University of
you.
the Western Cape, South Africa. My topic, spiritual care in complementary and alternative medicine, responding to the deeper needs of patients during COVID-19. For 6 decades, the University of the Western Cape has contributed significantly towards justice by means of community engagement, learning and teaching, as well as research and innovation. The research team that has contributed to this presentation, Professor Roman, South African Research Chair in Human Capabilities, Social Cohesion, and the Family. Dr. Tuli Mthembu, known for his doctoral thesis on spirituality and spiritual care for occupational therapy education. This presentation is based on an article recently submitted to the African Journal of Primary Healthcare and Family Medicine. The article, Spiritual Care, a Deeper Immunity, a Response to the COVID-19 Pandemic, will be published soon. Presentation. Recommendations for camp practice. What comes to mind when you think about spirituality? Do you think about culture, energy, the soul? Do you think about love and life? Do you think about that spirituality has many meanings? Nature. Or does it flow through nature? Do you think that spirituality resides within yourself? Or is it something that is external? Or is spirituality a connection between the internal and the external? No consensus on a real clear definition of spirituality amongst the scientists. But one thing is clear, that spirituality is an important factor for most populations, and it has been so since the beginning of recorded history. Spirituality is an aspect of humanity that describes the way individuals seek and express their meaning and purpose in life. It embraces secular, philosophical, religious, cultural beliefs and practices. In essence, spirituality describes the way people experience their connectedness to the moment, to themselves, to others, to nature, to that which they consider significant and sacred. Spirituality is concealed, hidden, not easily measurable. Actions and our behaviors. Research demonstrates that spirituality is closely linked to better health outcomes. Spirituality allows patients to deal better with anxiety, with stress, with the negative emotions that accompanies disease processes like sadness and grief and worry and hopelessness. Those patients who reported a higher level of spirituality also reported that they felt much more hopeful and they felt healthier. The World Health Organization emphasizes the importance of spiritual care alongside social aspects, the psychological aspects. So, spiritual care is defined as the actions that are required by the practitioner to meet the spiritual needs of the patient. It also refers to the care that is displayed by health professionals that fosters a relationship of respect, of dignity, of unconditional acceptance, of love, hope, and peace. Spirituality is a foundational component of every care modality, and many patients associate spiritual care within the CAM domain. So patients seek CAM therapies for spirituality. However, the research shows that there are inconsistencies between CAM theory amongst most CAM professions. There is a definite need to revive the holistic nature of CAM practice again. The topic of spirituality and spiritual care is on top of the healthcare agenda in most healthcare professions, but not so in CAM. And the research shows that there were certain barriers in education, practice, and research. Those countries that were afflicted by colonialism and had to conform to the biomedical model of reductionism. When CAM had to enter the mainstream public once again, it had to conform to these constructs. Therefore, we find that philosophies were sidelined. So the concept of spirituality and spiritual care was lost. Other barriers in clinical practice includes the lack of knowledge by practitioners. Some practitioners fear cultural sensitivities. Some say there's not enough time, and the list goes on. Definitely, there's a need to research this topic so that we can revive spirituality and spiritual care within CAM practice again. Current research indicates that during this pandemic, the reliance on spirituality increases for all societies, for all communities around the world. This pandemic has caused severe distress to most populations around the world. People need spirituality and spiritual care now more than ever. So, as CAM practitioners, we should provide a supportive environment of interdependence through a transformative approach of spiritual care. The World Health Organization recently highlighted the important role of spirituality and spiritual care in saving lives and reducing illnesses related to COVID-19. And governments around the world has labeled spiritual care as an essential service. So during times of uncertainty and distress, spiritual care has been proven to assist in reducing fear and anxiety. It provides the reassurance that patients need, and it promotes health-saving practices in their lives. And also, the patient has to have an understanding of spiritual care. There has to be access to valid instruments which allow the CAM practitioner or the integrative medicine practitioner to identify the levels of spiritual well-being in the client. Then, through a process of assessment, you begin to assess the needs, the spiritual needs of the client. Spiritual care begins with the practitioner having specific qualities of a multicultural counselor. Those soft skills, the bedside manner, compassionate presence, being an active listener, speak about their fears and anxieties, their hopes, their dreams and aspirations. To be a keen observer to those verbal, all of these recommendations can be found in all the philosophies of, of CAM. The temperament is an important factor. And Hippocrates reminds us that some people become better simply due to the good nature of the physician. So if you offer the patient these characteristics, these qualities, and you offer them, you are attending to their spiritual needs. Spiritual care begins with a spiritual assessment, taking a spiritual history, which can be intentional or situational. Intentional, you would rely on a spiritual history tool like this one, Fika. Asking simple questions. Do you have spiritual beliefs that help you cope with stress? Are you part of a spiritual or religious community? Generalized question that allows you to build, assess the patient, and it allows you to look at the status of the patient. Here is another example of a simplistic spiritual assessment tool. The practitioner can diagnose spiritual wellness or spiritual distress, characteristics and relating factors that can be found in the literature. Then the practitioner goes on to choose an intervention culturally inclusive, meaning that it embraces all types of beliefs and traditions and religions so that you can devise a appropriate intervention. Later, evaluate the client outcomes. At this point, the camp practitioner may choose to refer for further spiritual counseling or spiritual healing, or the camp practitioner can look within the philosophy of CAM. For instance, the concept of temperament speaks to the spirituality of the individual. And when it comes to an intervention, within CAM there's a host of mind-body therapies, spiritual therapies, breathing exercises, yoga, and the list goes on. And here the CAM practitioner can become particularly creative in finding a complementary system that suits the spiritual needs of the patient. I am currently conducting a PhD project, the development of guidelines for spirituality and spiritual care for Unani to practice in South Africa. This study is supported by the National Research Foundation of South Africa. It consists of two phases. In phase one, we are scoping the literature. We are conducting a quantitative study and qualitative study to gain information from UnaniTIP students, educators, practitioners, patients, and professional board members in order to develop draft guidelines for the profession. Through a Delphi technique, we will consult national and international experts on spirituality, spiritual care, and complementary and alternative medicine, and to provide the necessary expertise for the South African context. A heartfelt thanks to Dr. Arman, the scientific committee and organizers from the Tehran University of Medical Sciences, School of Persian Medicine. Thank you, and thank you to the participants. Well.
Thank you, Mojib, for your very nice presentation. We enjoy. And